Hello, everyone, and thank you for joining us. My name is Tim Russell, Vice President, Community Engagement for WTTW WFMT, and welcome to today's Chicago Tonight Latino Voices, a WTTW News Community Conversation. WTTW's purpose is to enrich lives, engage communities, and inspire exploration. The purpose of our WTTW News Community Conversations is to surface and spotlight people, ideas, and stories behind the headlines by creating a forum for residents, community-based organizations, community leaders, and residents to have authentic conversations. WTTW News Director Hugo Balta will moderate this evening's discussion, focusing on COVID-19's impact on Chicago's Latino community and information about the coronavirus vaccine, including Illinois' effort to eliminate barriers to get vaccinated. Support of Chicago Tonight Latino Voices is provided by CIBC. Additional support is provided by the Abe and Ida Cooper Foundation and Judy and John McCarter. Generous donors and our members, many of whom are with us tonight, support our community conversations as well. Welcome and thank you. At this time, I'd like to introduce you to Hugo Balta, the WTTW News Director. Thank you.
Thank you, Tim. Buenas noches y bienvenidos to Chicago Tonight Latino Voices, a WTTW News Community Conversation. My name again is Hugo Balta, WTTW News Director, Executive Producer of Chicago Tonight, host of Chicago Tonight Latino Voices, and your host for this virtual conversation. Tonight, we're talking about something that has been on all of our minds for nearly a year, the coronavirus. Specifically, we'll be talking about COVID-19's impact on the Latino community, which we know has been disproportionate and significant. We'll also talk about the COVID-19 vaccines that are becoming available. While you are all on listen-only mode, we really want you to participate in this conversation. If you have questions, especially as it relates to the coronavirus vaccine, please submit them in the chat and we'll pose them to our guests. We really want to hear from you and make sure that questions you have are answered. Now, before we get into it, I would like to introduce our guests, taking time out of their busy schedules to talk with us. Dr. Marina Del Rios, an emergency room physician at UI Health and the first person in Chicago to receive the coronavirus vaccine. Dr. Geraldine Luna, Medical Director of COVID-19 Response Bureau in the Chicago Department of Public Health. Miguel Blancarte Jr., Director for COVID-19 Response and Community Outreach, Esperanza Health Centers. And Enrique Mendoza, Vice President of the Southwest Collective and leader of the organization's COVID-19 efforts. He's a legal advocate at the Legal Council for Health Justice. Drs. Del Rio and Luna, along with Miguel Blancarte Jr., are all part of Illinois Unidos, a coalition of over 70 Latino elected and appointed officials, together with health professionals and representatives of community-based organizations. Welcome to all of you. Now, we've had a little bit of technical issues, and that's why we had a little bit of a late start, but I do believe we have everyone, so thank you very much for your patience. We're gonna begin with COVID's impact on the Latino community in Chicago, and later the conversation will revolve around COVID vaccine. If you have any questions related to it now, please share them with us using the chat function so we can answer them. So let's get to it. Latinx Chicagoans make up about 35% of total confirmed COVID cases. That's nearly double the number of cases among white residents and also among Black residents. Dr. De Luna, beyond those numbers, what do we know about the disproportionate health impact the virus has had on the Latino community? Disparities beyond case and death numbers like hospitalizations. Dr. De Luna, you're on mute.
Sorry there you go. That. Thank you for having me, everyone. And yes, it has been a bumpy road for us Latino population. We are 3 times as likely to get the disease and twice as high the risk of dying from it. And that has everything to do with the conditions like decades of racism, systemic racism and discrimination, and the nature of everything we do. We're overrepresented in all the healthcare, in all the workers line, and the way, in the lifestyle that all the things that we do to survive, all the things that now are working against us. Hospitalizations are highest. The second surge, we were leading charts in hospitalizations. And even there was a flip of death from African American communities to Latinos, having the highest percentage of mortality based in death adjustments. So these are all alarming numbers. And Hugo, the most alarming thing right now is rejection to our vaccine. Even though the vaccine can end this pandemic, like the barriers that the individuals, Latin community is facing or expressing, or the distrust, all the things that we have lived. Right now, 70% of Latinos are getting uptakes, are having an uptake of the vaccination, which is, again, is another alarming number. I'll leave it open to other panelists if they want to jump in and give a little bit more about that.
Sure, and as you mentioned, a lot of distrust, skepticism about the vaccine, and some of it rooted in some of the experience and cultural factors, and we'll get to in a second. I wanted to also talk about, we know that younger working age Latinos have been dying from the coronavirus across the country. According to the Latino Policy Forum last month, most deaths among people 20 to 59 years of age in Illinois were Latinos. As of January 8th, the hospitalization rates were highest among Latinos in the US. Dr. Del Rios, as an emergency room physician, have you seen this disproportionate impact in your own hospital?
Yeah, and I remember even early on in the pandemic, messaging with my colleagues in other hospitals because of, we were recognizing that there was really a disproportionate number of patients that were showing up at our door extremely sick that were Latino, right? I mean, I think that early on we saw all phases of the pandemic, but in terms of the people that were ending up hospitalized in the intensive care unit and at a more severe course of illness, it's been a disproportionate number of people that look and sound like the people on this panel.
Now, earlier this month, we visited Chicago's Northwest Side neighborhood of Belmont-Cragen, which has consistently been a coronavirus hotspot in the city. We talked with 36 Ward Alderman Gilbert Villegas about the cause of high COVID rates in the primarily Latino community. Let's take a listen to what he said.
We're made up of essential workers. And so that's why we have a high positivity rate, but also multi-generational living arrangements, where you have grandma living in a house and someone gets COVID in a 3-bedroom apartment, it's hard to isolate themselves. So this is the problem that we're having.
Enrique, your collective focuses on the southwest side of Chicago, which includes many Latino neighborhoods as well. Is the situation similar to that in Belmont-Cragen in terms of residents being essential workers and living in multi-generational homes?
Oh, absolutely. We have, I think we have one of the greatest concentrations of the Latinx community in the Southwest side. And yeah, we're exactly in the same position. I think, there's a lot of multifamily units around here, and a lot of the folks in those family units tend to be essential workers. And so what ends up happening is that, it sort of increases the risk of catching the virus. Mm-hmm. And so even both of my parents, actually, they're both essential workers and they both got the virus. Luckily, neither me or, my other siblings weren't able to, we didn't get sick. We were fortunate enough to be able to isolate and, take every precaution necessary, but it's difficult. It's difficult when, you have family that has to continually go out there and expose themselves, not by choice, but because, they have to survive. So definitely.
I just want to remind our audience to please, if they have any questions, to use the chat function in order to be able to get your questions to our guest this evening. Miguel, we talked with you in November in West Lawn. You mentioned how difficult it can be for some folks to isolate at home. You mentioned a safe haven to us, which is a free medical respite for folks who test positive for COVID-19 to isolate. Could you tell us a little bit more about the center and why it's so important?
Yeah, I first became aware of a Safe Haven Foundation, the medical respite that is set up there in partnership with the City of Chicago, CDPH, and Rush Medical Center. And it's a resource for individuals to be able to self-isolate, to be able to quarantine and recover from this without exposing others to the coronavirus. If they're unable to do so at home, for whatever the reasons may be, this is a resource that provides not only the stay there, the access to the rush nurses, it provides them with some guidance and just the ability to be able to recuperate. Over the summer, I encountered a family who had come by to get tested, and this family stopped by to get tested. It was a mother, father, 3 of their children, because the grandmother had just passed away. They lived in a multi-generational family. The younger grandchildren were coming in and out of the house, as were her daughter and her son-in-law, because they were essential workers. So the grandmother, who was in her 80s, had not left her house, but the virus came in to the house, and it took her life. So they all came by to get tested because they wanted to know, who it was that might have had the virus, not because they want to blame anyone, but it's just so that they can take the necessary precautions. And a safe haven is a resource that, if you do know that you are COVID positive and you cannot isolate at home because of the reasons of having other family members around, it's a resource that's out there.
We have our first question from the audience. This is from Iris Gutierrez. She writes, I'm scared to get the vaccine because I'm prone to random reactions, but at the same time, I have multiple pre-existing conditions that make me more at risk of contracting COVID. What do you recommend for people like me who are scared either way? When will we realistically get access to the vaccine in Chicago? Let's start with you, Dr. Marina Del Rios. Any suggestions, any recommendations, advice to our guests?
Well, so in terms of access to the vaccine, I'll let Dr. Luna speak to that, but I do understand that we have moved from tier 1A to 1B, which means that now we're expanding to provide access to our essential workforce. And the city has defined essential workforce as a number of work areas that are largely represented in our community. So people that work in schools, in long-term care facilities, that are police, fire, but Dr. Luna can elaborate a little bit more on that. But I will say, in terms of risks, I see this as how good are your odds of getting sick from the vaccine versus getting sick with COVID. And I just had this very same conversation with a good friend of mine who has multiple risk factors too. He's got high blood pressure, he's diabetic, he has asthma, and he's also an essential worker. And he called me concerned about, what do you think I should do? I've heard that people have adverse reactions to the vaccine. Do you think it's going to be a problem with all of my medical problems? The chances of you getting sick and hospitalized with COVID are pretty high. I mean, we're talking about, I don't remember the rate, but maybe like 1 in 100 people get sick and hospitalized with COVID. The chances of you getting an adverse reaction from the vaccine is extremely small. Severe reactions that lead to hospitalization, I think out of all the people that have been vaccinated so far, maybe correct me if I'm wrong, Dr. Luna, but it's been like 11 cases maybe that have been reported so far of all of the thousands of people, tens of thousands of people that have been vaccinated. So, and I always pose it as, I mean, look at the people around you. How many people do you know who have gotten sick with COVID and had ended up in the hospital? I myself stopped counting. And I think that my colleagues here probably have gotten to that point too. There are so many people that I know that are within 1 degree of separation that have gotten very sick or have died from COVID. And so when I see that compared to the minor adverse reactions that I've seen in my colleagues who have gotten the vaccine already, I'll play the odds with the vaccine.
Dr. Luna, can you talk to us a little bit about the vaccines and access and distribution?
Exactly. I agree with Marina totally. we have had 1,500 Latinos dying from a total of 4,325 patients dying from COVID. So this is a pretty high number. We can't afford to lose any more Latinos. We really need to vaccinate. And yes, we started today, the 25th. So those are great news, officially on 1B, which includes all the front lines, essential workers, as well as include any 65 years and older, and non-healthcare residential areas. So facilities that have, again, our seniors over 65, maybe in better conditions than the one that are in a nursing home, but all those. And those include, as Marina was mentioning, teachers, and include socorristas or first liners. It includes police. It includes our transit. It includes teachers, pre-kinder, all those congregate settings. The most important thing is to understand congregate settings where people are working arm to arm, rubbing shoulders, and all those conditions that the outbreaks are being the highest. Realistically speaking, going to that question that she asked, which is a very good question, very valid, the concerns about how soon can you get the vaccine, is it's limited by supply. Unfortunately, that's the only reason we're using this equitable framework. It's because we can't vaccinate everybody at once. So we're using it based on risk. People that have the highest risk because of the nature of their jobs, of dying or contracting the disease and eventually dying from it, those are the ones that we're giving priority. But with patients, all individuals in Chicago are to get this vaccine. It's for free. Nothing should keep you from getting it. Unfortunately, the uptake has been compromised somehow with all these myths, with all these concerns, questions, and the skepticism of people getting it. You know, there's alarm signs that keeps me from getting what it's going to save my life. And that's what we're facing with our Latino population, which has started from the healthcare workers, which were the first one that we vaccinated, going little by little decreasing. We even have like 3 institutions just for people to see, just to put some strong visuals out there of what's going on in our community, that the residents of this facility and the healthcare professionals, there's a mismatch. Healthcare, 35 getting or accepting the vaccine versus 60% of the healthcare professional. And we're talking at Latinos. This is not white people. We're talking about Latinos. And then we have the second resident that they're both of them. 30% of residents of this long-term care facilities getting the vaccine, meaning that 70% just rejected it. And then the same amount of people of our healthcare workers. And then we see that our residents in another location in highly hit sectors, we're not talking about African Americans, or we're talking about Latinos here, highly hit sectors for Latinos with an uptake as high as 50%, not really that high. And then we have our healthcare personnel, 20%.
Let me ask Miguel, you know, you're a part of the Vaccine Course Partnership. What has the organization's work looked like over the past month or so of vaccine distribution?
So I think with the Vaccine Corps partnership, the focus has really been to work different institutions and have the community voice come into this, right? So it's working with the departments of public health. It's also working with the hospitals, FQHCs, but it's also really about working with the community-based organizations to be able to correct all of the misinformation and really be able to provide accurate information in various languages, including Spanish. Particularly though, with Esperanza Health Centers, our approach has been to continue informing our patients. A couple of weeks ago, we actually surveyed a large percentage of our patients that had identified themselves as Hispanic Latinos over the age of 18 years old. We sent out the survey in 2 languages, English and Spanish, and we actually had a really good response rate. We had over 2,000 individuals that responded to the survey itself. And it's really about getting their input and being able to respond to that, listening to them and listening to whatever hesitancies may be there and addressing that. And knowing really where they receive their information from as well, what are the resources that they rely on for information. So is it Spanish language television? Is it the news? Is it their own doctors and providers? And I think going back to the prior question that was asked of when realistically would we be able to be vaccinated, I think it is important for, especially to make, well, first of all, to bring the awareness that right now the city of Chicago has released some doses for 65 and older, right? So if you're 65 and older, I think the important thing is to contact your provider and see if your provider, your doctor, your clinic is offering the vaccine itself. Because if they are, that's probably the better choice for you to receive it in. And in addition to that, it's also a way of connecting you to care. Because I think we've seen what the pandemic has done, that we hopefully we realized a little bit more the importance of health and that we should be a little bit more attuned to our health. And so being able to connect with our provider, with our doctors, I think that's extremely important right now and moving forward.
Let's continue talking a little bit about equitable distribution. Enrique, on Thursday, we talked with Jamie, the founder of the Southwest Collective, while visiting Archer Heights. When asked about inequitable distribution, she mentioned the lack of health infrastructure. Let's listen.
And there's just not enough healthcare resources here. You go downtown, there's a hospital every other block. You go up north, there are branches of Rush and there are branches of Northwestern, but you don't have that down here. That system does not reach the Southwest side at all. And it's a major issue.
All right, Jamie.
Enrique, could you tell us more about the lack of healthcare infrastructure on the South Side and what that has meant for residents during the pandemic?
Yeah, absolutely. And I've spoken about this multiple times, and it's something that I've come to notice or analyze a little bit more as I've joined, legal aid and specifically, health law. Yeah, there was just not a sufficient network of health centers in the Southwest side to really accommodate the great need of, testing that was that we needed here this past year. We were super behind and we had to play catch up. If it weren't for the mobile testing sites that sort of, came in here and filled in some of those gaps, honestly, I couldn't imagine, what that situation would look like. Well, it would look much worse actually, but, that's why we tapped into resources like the community organized relief effort. The only problem with mobile testing units is that, a lot of, one, you have to secure a location. Two, there's capacity issues, and then three, there's just not enough consistency for folks to know where they need to go. And so the thing is that we just need more health centers here in the Southwest side. If you take a look at a map, and I'm willing to bet that if we did some sort of research in terms of like, health centers per square mileage, you would find significant gaps in the Southwest side. And when we talk about also, not just FQHCs, but also hospitals, the only hospital really that we have here is Holy Cross, and that's over by Marquette Park. And if you go a little bit more, northeast, then you'll hit Cook County. You'll get Stroger. The New York Times actually released an article that sort of mapped out the ICU beds and their capacity levels. And if you took a look at that map, there's a huge gaping hole on the Southwest side. All you really have is, again, Stroger, and you have another hospital, which is Advocate, but that's out in Oak Lawn. So a lot of folks aren't really familiar with those facilities. And so I think that was very telling about what the situation in terms of healthcare infrastructure looks like in the Southwest side. And on top of that, the other hospital, I think, under threat of closing was was it McNeil or sorry? Yeah, right. Mercy. There you go. I'm thinking of McNeil, but yeah, Mercy. So yeah, in terms of like where our priorities land and how we can better flex our fiscal muscles, I think that healthcare should definitely be a priority because a lot of our communities had to play catch up. So yeah, that's one serious issue that we've been talking to the city as well, and we've been letting them know that yeah, we're struggling out here, right? And it's for a reason.
We have another question from our viewers. This one is from Caritina Almanza. She asked about how to talk with people who are hesitant. I know very conservative friends who said that they will not get the vaccine because it contains fetus tissue. First, how do I talk to them and give them correct information in Spanish about the vaccine, and have more heard about this myth? How about starting with Dr. Luna?
Yes. Having this conversation in a linguistic and cultural concordant manner with the competencies that it requires is so important. Sometimes we have our population that it's low proficiency, even though they do speak English, but not to the level that they would comprehend if the language was not a barrier. And I think that having these candid conversations with your medical doctors, with your equipment in your medical home, whenever you, with places that you feel comfortable, that you trust the people, is so important. If religious beliefs are one of the barriers, having this conversation with the archdiocese or the pastor of your church, or all the information coming from the bright places. We've heard of myths related to blood components or chips, and we have heard so many things that debunking the myths is so important. Well, these conversations need to happen, and it has to happen in a place that people feel comfortable and that they feel that trusted people are addressing their issues. And once they feel we can overcome these important barriers, then people are more willing to receive the vaccine, as we should.
We have another
Well,
question. I'm sorry.
If
please.
I may add to this, I'm going to repeat something that a colleague of mine who's a toxicologist said, who I thought put this in the simplest term that I think most people would maybe find palatable. The elements of good cooking include sugar, fat, salt, and the main component, right? That's exactly what the COVID vaccine has. Sugar, fat, salt, and the mRNA that our cells need to make the protein that will then lead to the production of antibodies. So no, it does not contain fetuses. It does not contain microchips. It is a very simple component, and it's the stuff that we eat and ingest every day, just in a little injection that puts our immune system on guard.
Another question from our viewers. Gustavo asked in our chat room. Gustavo says, for the vaccine, it's been a topic of conversation in my immediate family and certain close extended family, is that we do not know the short and long-term effects that come with it. For many Latinos, that's a concern, mixed with pre-existing conditions, with ongoing conditions, disease being treated. Dr. Del Rios, what would you say? And that's one that particularly I also share. My wife is a liver transplant recipient, and we've been talking to our specialist, and I gotta say, it's a little bit confusing because we're getting sort of 50-50, right? We know this is very important. I'm certainly going to get vaccinated, our children as well. But it's something that all of us are having this conversation. What advice do you have, Dr. Del Rios?
Well, so we do have some information about side effects that came from the clinical trials. And most side effects are not unlike the side effects that we get from other vaccines. You might have soreness at the site of injection, maybe some swelling of your lymph nodes as your immune system is reacting to the vaccination. Some people might develop some fever, some body aches, some headaches, short-lived, usually only a day or two after the vaccine. I can speak to this firsthand, having received already both doses. The first dose was fairly inconsequential for me. I just had some mild soreness at the site of injection. With the second one, I did feel a little bit sick, not terribly sick, but sort of like when you feel at the beginning of when you're getting a cold, a little bit of body aches, a little bit of a headache, just kind of achy and a little bit tired, and nothing that couldn't get resolved with some ibuprofen, Tylenol, and a good night's rest. And by day 2, I was already fine. So one thing that the CDC is doing, and when you get vaccinated, you will be invited to participate in this vaccine monitoring system that is called, Geraldine, is it BSAS? Is that what it's called?
BSAS.
Yeah, it sounds about right.
Yeah. So you'll be invited to sign up for that. And basically what we're doing is keeping track of everyone that is now getting the vaccine post the clinical trials to see if there's any other new reactions that may pan out that we don't know yet because the vaccines haven't been developed long enough, right? So even I still to this day get weekly text messages saying it's time to sign in and let us know how you're feeling today. And I'll continue getting messages for the next few months, again, to monitor those of us that have already gotten vaccinated for those long-term side effects. And so far, I'm happy to report nothing to report.
Great. Let me see, looking to see if we have, let's talk a little bit about mistrust. Obviously we're seeing from some of the questions that we're having, a lot of trying to debunk, trying to separate fact from fiction. But let's talk about the historic mistrust behind the coronavirus vaccine. And it's not the coronavirus vaccine, it's really vaccine in general. Really the interaction that Black and brown people unfortunately have had with health officials. Miguel, what is behind some of this mistrust?
I think some of the mistrust is, history, right? History is a component of this, some of the testing that had been done in certain communities in the past, and it's distrust that persists, and it's distrust that you'll see, in the Latino and the Black population, whether you're, an essential worker working perhaps at a restaurant, a supermarket, or if you're a healthcare professional yourself. In December, as an FQ, as a federally qualified health center, we surveyed staff, and there was hesitancy from staff. About 1/3 of our own staff, showed hesitations toward getting a vaccine. About 2 weeks ago, I went into a pharmacy and I spoke with a pharmacist, and I asked her, I said, "Oh, have you received your vaccine?" Excited, right? Because we had been starting to distribute it at Esperanza. And she was African-American, she was Black. And she said, "Nope, I'm not gonna get it anytime soon. I'm waiting." And I think that's what I've kind of been seeing, right? That some folks are kind of waiting more time to receive the vaccine. And hesitations are there, definitely. But at the same time, at least in my perspective, if you're offered the vaccine, if you have the chance, if you have the access to the vaccine itself, I would take it. I would see that opportunity to, hopefully not expose myself to the virus. Whether you can still spread it or not, that's another story. That's why we still need to continue wearing the face masks, social distancing, washing our hands. But at least that there is some sort of protection. You're either 94, 95% protected, depending on the vaccine. And I think that speaks volumes. And I think that should help settle some of the hesitations about receiving the vaccine. Where when the virus came out and the talk of the vaccine started happening, it was in a very different administration on a federal level. And that might have also only added to the hesitation. But now that the vaccine is here, now that the distribution, that people are being vaccinated, that it's out there, that there is a new administration, that there is a different approach to communicating information, I think that's positive, and I think that will help ease some of these concerns.
Now, you've mentioned essential workers. We've been talking about essential workers. Certainly, we've seen they've been the hardest hit. migrant farm workers in Illinois and across the country have been significantly affected by the pandemic. Enrique, how has the virus exacerbated this existing inequities and health disparities with migrant workers?
I mean, the fact of the matter is that like, a lot of, there's just not enough resources for folks like migrant farm workers, anybody who is undocumented. Also, I think the problem here is that when it comes to policy, a lot of these communities just don't see that they're a priority. And so when something like a public health crisis, such as a pandemic happens, and, I don't think that they feel like the government is actually prioritizing their needs. And I think that has a lot to play with it. I mean, the previous administration did a very good job about, really unleashing lots of harmful policies on immigrant communities. And so it clearly sent a message that, well, you're not welcome here, basically. And as a result, it did, dissuade a lot of folks, away from, a lot of public benefit programs. One in specific, public charge was obviously a focus of the Trump administration. And I feel like that it's just things like those, right? And it doesn't just stop there. Really, previous administrations have done a good job about, keeping undocumented communities away from, things like public benefits, any sort of government assistance programs. And this really started all the way back to, 1996, right? There was a huge change in welfare reform. And so, again, that sort of clearly sent a message that we are not prioritizing, an undocumented community, an immigrant community, as part of our, federal policy. And I think eventually, folks just figured, well, there's really nothing out there for me, right? And when it comes to something like a vaccine, that's why there's so mistrust. There's a lot of mistrust, especially with the way that the federal response was to this pandemic. And so I think a lot of that stems from that. And again, I think even just going back to lack of healthcare infrastructure, I think if we're not, again, that wasn't a big priority in the Southwest side. And I think that's sort of what's led also to not very, there's not a lot of health literacy around here. And I think that's something that definitely could have helped. There's been multiple medical journals that have said that, really helping folks develop, their health literacy skills can definitely help them, manage their conditions, really understand what's it called, how to manage it. And on top of that, I mean, when you're talking about immigrant communities, I mean, they're coming from they're also coming from like countries where they also lack healthcare infrastructure, right? A lot of them came here before they even, and one big example is Mexico. Like, they didn't really have like a public health program available for folks who are low income or have no income at all. And so a lot of them left before something like that was even created. And a lot of them are just not even used to going to the doctor. And, they don't have like someone like Dr. Rios telling them, what the vaccine is composed of, that it's safe, and that, why you should, lean towards taking it. So there's just a lot there that, historically, has created a mistrust, and they need folks on the ground who they trust, who they know, they can definitely, they can trust the information coming from.
And look, you said it, trust is so important. And we all know that we have to lead by example. And so I wanted to ask a question to Dr. Del Rios, which she's been asked before, but I think it's important to emphasize. You were the first person to get COVID-19 vaccine in Chicago. Could you tell us the significance to your patients, to the Latinos, of you getting the vaccine?
Well, I always say that you have to lead by example. And if you have to put your actions where you put your words. And so for me, I mean, let me be clear. I decided to volunteer to get the vaccine in part for very selfish reasons, right? I want to protect myself. And I also want at some point to be able to visit my mom, who I have not seen in a year, because I understand that I am a risk factor for her, that she's an 80-year-old woman and I could very well bring the virus to her. And so I made this decision out of both those selfish reasons for myself and for my family, but also because I recognize that our community has been so hard hit. And I think many of us have experienced personal loss. I know I have experienced personal loss, and I feared for the safety of my family. And, you know, I think it was important to show those that I love that this is safe and it's efficacious and it's our way out of this reality that none of us like right now. None of us Latinos like to be together. We like to party together. I miss my parrandas from Christmas. I miss my big family get-togethers, our meals. The vaccine is our way to getting back to that normalcy. And so I thought it was very important to show folks that I, as a physician and as someone from their community, felt comfortable playing the odds with a vaccine, knowing that that might bring us closer to our normal life again.
Let me bring up another concern, and this one's for you, Dr. Luna, that we've been hearing a lot about. Some are concerned about the development timeline of the vaccines, fearing it was developed too rapidly to be safe. Is that true?
You know, that's a question very, very commonly asked, and it's not true. It's not that quick. I mean, we're giving a pandemic in in the middle of an emergency. Well, there is a lot of things going into it, but SARS-1 presented itself in 2002. So we're talking about like a lot of information data from the first presentation of what then became SARS-2, SARS-1 in 2002, SARS-2 now is COVID-19. And then the technology has been out there in the market, you know, it's for 10 years now. It's a decade of time. So putting those two together and all these pharmaceutical companies opening their doors to collaborations around the world of medical scientists, academic institutions, hospitals, people that really know what they were doing came up with what is known now as the vaccine, COVID-19 vaccine. So there was no corners cut. There was no skip in the processes of safety. Everything would have the same scrutiny and the same rigorous process that we do for any other vaccine here in the United States of America. So there was nothing short about it. The great thing is that it was a collaborative effort, and that's the way we had it. And because the COVID-19 turnover, like the affection in our population is so high, it was easy to see the experimental part of that and the control group with the cases occurrences. So that's how we came with the 95% efficiency, comparing both groups, both trials. So no, it hasn't been that short. It has been a long history, a long time to this point. And I understand that compared to 10 to 20 years with other medications, which it normally takes, when the pharmaceutical companies are doing it all by themselves, paying everything and engaging. But the way that it was created, it makes total sense. So it's comfortable. I felt safety. I got my vaccine too. And as igual que Marina, the symptoms were very mild and nothing compared to suffering from the real disease or dying from it.
Well, it's really good to hear no corners were cut in regards to the vaccine. And like you said, it's about collaboration. We have another question from our viewers. This one's from Lucia Flores, and she writes in Facebook, the Cook County Health Department serves large immigrant population, and there are images of National Guardsmen at vaccine distribution sites. How can healthcare providers counter these problematic images that may keep Latinos and other immigrant communities away from vaccination sites? Miguel, what are your thoughts about barriers to getting vaccinated, particularly related to a person's immigration status, like Lucia Flores just mentioned?
Yeah, I think that's, you know, the important role of the family clinics, right? That individuals are accustomed to going to and having access to that. I think the importance of community-based organizations as well, of faith-based organizations too, that kind of help with taming those fears of you know, having the National Guard there potentially in rural areas. I think, you know, the question that you asked earlier as well about farm workers, I think we need to ensure that they get vaccinated as well, because farm workers in rural Illinois are the essential workers of Chicago, of our cities, right? And it's extremely important. We see the disparities of how COVID is impacting essential workers in the city of Chicago, how COVID has been impacting not only with high positivity rates, but morbidity rates as well of Latinos who are in the essential, who define themselves as essential workers. And so for farm workers, we need to make sure similarly that they get vaccinated, that they have access to the vaccine as well, because they're part of the infrastructure of the state, of, you know, making us sustainable, providing us the crops that we see in the grocery stores, that we go in and buy. And in not vaccinating our essential workers in the city, and not vaccinating our farm workers in rural Illinois, that's an injustice. And, you know, that's something that we need to ensure that all of the health departments from the different counties, including IDPH, is working to provide the vaccine. And I think that's when, at that point, right, having that good communication with these individuals, with our farm workers in nuestra lengua, en la lengua que ellos usan, in Spanish, and involving the community-based organizations, involving the religious faith leaders, and involving the trusted faces that are in those communities themselves.
Thank you, Miguel. I wanted to talk a little bit, Enrique, and really this is to all of you. You know, we're coming to the close of our community conversation. Enrique, you know, what's the role that media should be playing in this crucial point in COVID-19, especially with the rollout of the vaccinations? What can we at WTTW do better?
I think just reporting the information responsibly, because I know that a lot of news sites, I tend to see like all the horrors of like, you know, the adverse side effects of the vaccines, like somebody was hospitalized and stuff like that. So, you know, in the media, I tend to see a lot of like, you know, what's all the bad that's happening, right? So I think maybe the focus should just really be all the good that the vaccine is doing, just keeping people informed about, you know, what stage we're at. Because the thing is that there's a lot of folks, I just posted in a neighborhood group, and a lot of them just seem to, you know, not know what's going on, you know, in terms of, you know, vaccination. And they just want accurate information. They just want to make sure that that they know, you know, that they're understanding what the situation is and where they're at right now. So I think media, just as long as, you know, we're really, you know, having even doing this, right? Having Dr. Luna, Dr. Rios talk about, you know, the safety of that vaccine. I think that should really be priority number one.
Well, thank you. I agree. I think one of the things that is very important for media to do is to have these types of conversations, right? Lend our platform to really listen to the public, chip away at some of the inaccuracies that unfortunately is out there, especially in the social media space, and really listen to experts like yourselves that will help the public make better decisions. And as we've seen in this almost year under COVID-19, help them make decisions that ultimately will help save lives. I want to, you know, thank you for lending your time in spending this hour with us and answering our questions, the questions of the public. We've shared a short Google form in the chat. If you click it, you can submit ideas, stories, topics, and issues to us that you think we need covering. And that's really important. You know, for us at WTTW, Chicago Tonight, Latino Voices, Black Voices, certainly WTTW.com, news.com. It's important for us to hear from the public. It really helps us shape the stories that we cover and the focus that matters most to them. So please take a moment to fill out and share your thoughts. Thanks again for joining us this evening. Please join us next month on Monday, February 22nd at 8 o'clock. My colleague, Brandis Friedman, will host the Chicago Tonight Black Voices Community Conversation. On behalf of the WTTW News team, thank you once again. Please stay informed, stay healthy, and stay safe. Muy buenas noches.